Watch this video till the end to get a knowledge about the clinical feature histopathological changes in psoriasis and also to know the differences between lichen planus and psoriasis. This is the question. Pause this video and try to answer, and if you have marked the answer as option D, then you are absolutely right. So what is the question asking? True about psoriasis are all except. So you need to identify the odd man out, that is the characteristic feature which is not associated with psoriasis. And mind you, this is a previous year question for FMGE aspirants. So you can see in psoriasis option A, that is Kogoj microabscess, will be seen, and also Munros microabscess can also be seen, and also oil drop sign is also seen. Basically, what are these? So Munros microabscess are aggregation of the neutrophils which is seen in the stratum corneum. So neutrophilic collection, if it is present in the stratum corneum in psoriasis patients, in the histopathology we call it as Munros microabscess. Whereas option A, that is Kogoj microabscess, these are basically called as spongiform pustules of Kogoj. These are again the collection of the neutrophils, but now the level of the collection of neutrophils is not stratum corneum, it is stratum spinosum. Stratum spinosum, okay. And what is oil drop sign? This is also called as Salmon patch. And where is it seen? It is seen associated with nails. So in the nails of the psoriasis patients, we can see that as if a drop of oil is present in between the nail plate and the nail bed, and this is called as oil drop sign. And mind you, this is very important. Why? Because this is most characteristic nail change in the patients of psoriasis. So instead of most characteristics, we can also call it as pathognomonic. So this is a pathognomonic lesion. That is, if a person has this oil drop sign in the nail, then we can certainly search like a detective and find out that he might be having already a psoriasis lesions over the skin, or he might develop in the future. So why am I telling like this? Because the psoriasis lesions are most of the times asymptomatic. That is, patient might not be aware of the psoriatic lesions. Okay, I will show you the next slide. In this picture, you can see that the lesion is characteristic of psoriasis. That is classical description. You can see a well-defined erythematous silvery white scaly plaque is present. Most likely the psoriasis lesions will be present over the extensors. So despite the gross appearance of this lesion, you might think that the patient might be having so much of itching or burning sensation because of this lesion, but exactly opposite to what we think. The patients usually will be most of the times asymptomatic. The lesion will not cause any kind of itching or whatsoever, but the basic problem sometimes few patients can experience is because of the extreme dryness. They might experience a sense of tightness in the lesion. That is the most important symptom which the patient will try to explain us. For that, what we can do is so the treatment we are not going, but moisturization of the skin is very crucial for these kind of patients who are having the symptom of tightening of the skin. So now since we have discussed psoriasis, so hand in hand we will also see few points about lichen planus. Why? Because these two are very extremely important papillosquamous disorders, and in the FMGE exam, the December 2021 exam, actually apart from this question on psoriasis, there was one more question on lichen planus. I will discuss that in the future videos, but right now we will just see what are the similarities and what are the differences between these two conditions. So both of these are chronic inflammatory diseases of the skin. Both of these are of course papillosquamous disorders. Papillosquamous, there will be papillary lesions, and also there can be plaques, and yes, there is scaling. So both of them put together we call it as papillosquamous disorders. And there are many differences between these two conditions. So as you can see, in psoriasis there is a genetic association. Yes, this is a question for you. Just fill in the blank. So what is the genetic association which is seen in the patients of psoriasis? Type in the comment section. In the lichen planus, there is no such genetic association which was seen till now. And coming to itching, as I've already told you, psoriasis patients are asymptomatic, there is no itching, whereas in the lichen planus patients, if you remember, there are 5 P's, out of which one of the P is pruritus. The patients are going to have extreme itchiness over the skin. And now coming to the oral lesions and the involvement of the hair. So oral lesions and hair involvement are absent in psoriasis, whereas if you see in lichen planus, you have these Wickham striae, which are nothing but the reticulate white streaks which can be seen in the buccal mucosa. And also alopecia can be seen, and that too not ordinary alopecia, it is scarring type of alopecia, that is permanent loss of the hair can be seen in the patients of lichen planus. And of course, psoriasis is not just a disorder of the skin. Please remember, it is associated with metabolic syndrome, and also it is associated with inflammation of not just the skin but also the joints. So there will be arthropathy, but lichen planus is not having any such associations. So these are the histopathological, characteristics of both psoriasis and lichen planus. So we have seen psoriasis, Munros microabscess can be seen. And also we have discussed the spongiform pustules of Kogoj, they can also be seen. But apart from this, there are certain other histopathological changes. So just for the sake of revision, retention of the nucleus will be there in the stratum corneum, which is called as parakeratosis, and there is going to be a thickening of the stratum layer in a regular fashion, that is regular acanthosis can be seen. Whereas in the case of lichen planus, wedge-shaped hypergranulosis is very important to be remembered, and also acanthosis will be there, but that acanthosis is in an irregular fashion in lichen planus. And also one more buzzword, saw-toothing of the rete ridges can be seen in lichen planus. So I hope this explanation was useful.